So today we're going to be talking about birth control pills, which are also known as oral contraceptives or OCs for short. So how does the birth control work? Well, normally in your body, progesterone and estrogen are used, and that you can see in the top graph on the right. So you see the changing levels of the hormones there. But with the pill, derivatives are used. And as you can see in the graph on the bottom right, the levels of hormones are a lot more constant. And this data is actually specifically for the combination progestin and oestrogen pills, which are those derivatives. So these constant levels mean there are no peak in estrogen, meaning no egg release, and then no chance of fertilization and pregnancy. The pill also does other things to help prevent fertilization, which is that it thickens cervical mucus, therefore, sperm can't get to the egg. And as well as that, the lining of the uterus becomes unreceptive to implantation of a fertilized egg. So, all drugs need to start somewhere. So, with the birth control pill, since progesterone is barely absorbed when administered orally, that's why a derivative needs to be used instead. One of the first synthetic oestrogens was mestranol, which was added because breakthrough bleeding was occurring without it in just a progestin based pill. So the first contraceptive pill approved by the FDA was Envoid with the composition of 10 milligrams norethindrel and 150 micrograms of mestranol. It took a little bit longer for other dosages to be approved by the FDA, but they were. And then after that, that kind of got the ball rolling, and other brands emerged, and new dosages emerged and were approved. So, moving on, continued research then found that oestrogens alone were also effective in suppressing ovulation, which is why today we have pills that are progestin only, oestrogen only, or the combination pill, which is progestin and oestrogen. And actually, a fun fact is just that married women in the United States weren't allowed access to oral contraceptives until 1971, so about 10 years, 11 years after the pill was approved. So it was only recently that natural estrogens began to be developed successfully, but there's no data on if this really offers any additional advantages because this has only been happening within like the past 20 years. So obviously we know that drugs don't just stay the same once they're released. They continue to develop and change. And so the continued development of the birth control pill was based on the reduction of dosages, new progestins, various oestrogen progestin administration schemes, and this was all really geared towards wanting less side effects, but also competition between pharmaceutical companies, the advance in knowledge of hormonal mechanisms, monitoring of endocrine and metabolic effects, as that really does need to be studied over time. So, the first alarm of the birth control pill came from the thromboembolism effect from the oestrogen. And it was found that pill users were more susceptible, which then led to a reduction of dosage to lower this as well as other side effects. Although, even at the low doses, there's still a prothrombotic effect. After this, new administration schemes were explored and the sequential pill was developed, but this pill is actually no longer available. But it did pave the way for development of various and changing combinations of oestrogen and progestins. And then next in line was the progestin dosage reduction. So because of the development of LNG combined with ethinyl estradiol. So this pill is actually the one most frequently used today and was developed in the 60s, so it's been being used since then. And then in the 1990s, these new third generation progestins were developed and released and started to become really popular. But it turns out that they actually increase the risk of the thromboembolism by about 2 times that of the second generation progestins. So then that actually went backwards, and we had it return back to those second generation. Also, new progestins recently developed were incorporated and are incorporated into novel pill formulas, which really target specific side effects for women with varying health issues, which could be really beneficial to them, as without these novel pill formulas, they really wouldn't be able to be on birth control.
So for our presentation, although there are many forms of hormonal birth control, we're going to concentrate on the birth control pill because it is the most widely used form of contraception in the world. An estimated 140 million women worldwide use hormonal contraception. This number accounts for approximately 13% of women between the ages of 15 and 49 years. 28% of reproductive age women in the United States are on birth control pills, which are taken orally once per day.
So moving on to the mechanism of action. So when you ingest birth control, it goes into your stomach and then your small intestines, where it is absorbed easily because it's a lipid-soluble compound, which means it can pass through the membranes. But if you throw up in about a 2-hour span after taking it, the birth control won't be effective because it takes about 2 hours to be fully absorbed. Then it moves into your liver, where it's metabolized through the phase 1 and phase 2 reactions we learned about in class. And in phase 1 reactions, both estrogen and progestin are broken down into smaller metabolites. And then in phase 2 reactions, it's prepared for excretion by turning into a water-soluble compound, and it can also turn into sulfur metabolites, which can be harmful if they build up, and it's excreted in the feces and urine. Moving on to the effective organ systems, these are more acute effects, but they can also be chronic. Starting in the liver, it can cause hepatic adenomas, which are benign liver tumors, and they're not usually issues unless they rupture because it can cause internal bleeding. Another effect is cholestasis, and this happens in the liver when bile secretion is either limited or stopped, and side effects could be itching, dark urine, vomiting, potentially organ failure, and weak bones. And that can also cause high blood pressure because bile is secreted in the liver, and it's a major component of it is cholesterol. And then when it goes into the small intestines, fiber takes it up, and then it's excreted from the body. But if your body isn't producing bile, then it can't take in the cholesterol and get rid of it. And in addition, if you don't have bile, then it won't let you break down fat-soluble compounds, and you won't be able to absorb a lot of different nutrients. Another beneficial effect is in the skin, and this is if you take a combination pill, and it limits the androgens in your body, and androgens are responsible for sebum excretion, which is oil, and if you have less oil, then you have less acne. It can also have an effect on the endocrine system in the brain, and a major effect is depression. So progesterone increases the amount of these things called monoamine oxidases, which lowers your serotonin levels, and estrogen raises your serotonin levels. But as you saw in Grace's slide, you have stable levels of both throughout your pill cycle, but there's more progestin. So this can cause you to have lower levels of serotonin in your body throughout, and it maintains more than just your mood and anxiety levels. It also aids in sleep and digestion. So if your serotonin levels are off, it can have a big effect on your body. And then this is mostly for diabetics, but it can raise your blood glucose levels, and so this increases your insulin resistance. So for diabetics, this means they have to take more and more insulin, and then down the road, it can cause the other effects of diabetes to be worsened or to occur faster. So this is things like nerve disorders and becoming blind.
Birth control pills are intended for women of reproductive age, and the amount of hormones in each pill are carefully calculated for safety. Like with any medication, contraceptive pills can sometimes be misused and can result in an overdose. Cases of unintentional consumption of these pills by children is relatively common, but studies show that it is not dangerous in the long term. A 2009 prospective observational study assessed the short-term consequences of pediatric unintentional consumption. They were looking for evidence to support or reject the potential for vaginal bleeding with pediatric overdose. There was no evidence found for vaginal bleeding, but 44% of the 63 cases experienced mild symptoms of vomiting. Children who swallow hormone pills are not in danger. The medicine is absorbed quickly and is quickly eliminated from the body. There are no long-term effects for girls or boys. If a child accidentally consumes birth control pills, call poison control. Some brands of contraceptive pills can contain iron. Depending on how much the child weighs and how much they consume, there's potential danger for iron poisoning. Some adults intentionally overdose on birth control pills in suicide attempts. For example, one study brought to light an unfortunate trend of intentional overdose on birth control pills in Sri Lanka. But 2/3 were discharged on the same day that they were admitted, and none had severe symptoms. In another case report of a 29-year-old female, presents with a pulmonary thromboembolism. Exogenous estrogen is known to increase risk of venous thromboembolism and therapeutic use, and will be discussed in the next slide, but pulmonary thromboembolism can occur in single high-dose intake.
So one of the main concerns about being on the birth control pill for a prolonged period of time is the increased risk of venous thromboembolism, also known as VTE. And this is a serious condition because it can manifest as either deep vein thrombosis, so blood clots of the leg, or pulmonary embolism, blood clots in the lungs. And in serious cases, this can lead to heart attack or stroke if the blood clot breaks free and travels to the heart or the brain. So the reason that birth control increases the risk of blood clots is estrogen that's in it affects the gene expression of various hepatic proteins that are involved in things like coagulation, anticoagulation, and fibrinolysis, which is involved in breaking up blood clots. So basically it increases the clotting factors. So some of you may remember the Yaz and Yasmin birth control controversy that happened a few years ago. So basically this was a new birth control that came on the market, and it contained drospirenone instead of the typical progestin that is usually found in birth control. And so basically after a number of years, there was an increase in incidence of women getting blood clots, and some of them had complications and even died from them. So basically in 2012, the FDA did their own study and concluded that pills containing drospirenone had to alter their labels to include info about this increased risk, but they didn't recall it completely from the market. So another concern about prolonged use of birth control is the increase in cancer risk. Birth control can increase the risk of breast cancer because breast cancer cells have receptors for estrogen and progestin, so these hormones can bind to the cancer cells and stimulate their growth. A number of observational studies over the last few years have confirmed that there is a modest increase in the risk of breast cancer. It's generally assumed to be around a 20% increased risk, and this risk does increase with age and the longer that you're on the pill. Birth control use is also associated with an increased risk in cervical cancer, and this is because the hormones estrogen and progestin, it's thought that they make the cervical cells more susceptible to HPV infection. However, the majority of these observational studies have also found that oral contraceptions can decrease the risk of ovarian cancer, endometrial cancer, and colorectal cancer. So in conclusion, even though the birth control pill has been modified over the years to decrease the number of estrogen in it, there is still a modest risk of side effects like VTE and certain cancers. So there's only one extra breast cancer for every 7,600 users, and the likelihood of getting a blood clot is about 3 to 9 out of 10,000 women. So the majority of young, healthy women have nothing to worry about. However, if you're a smoker or over the age of 35, have a family history of VTE or other cancers, or if you have other cardiovascular risk factors such as obesity, you might want to talk to your doctor about other options. So there is progestin-only birth control pills, which are also known as the mini pill, and these have been found to lower the risk of these complications. And there's also non-hormonal methods such as IUDs. Overall, the benefits of taking birth control pills, such as preventing unwanted pregnancy, reducing PMS symptoms, regulating periods, reducing acne, and even decreasing the risk of some cancers, far outweigh the health risks for most healthy women under the age of 35.